Hi, and welcome back to Consider This, Simplifying the COVID Conversation. I'm Heidi Beidinger. Well, this is my final presentation in which we're going to be tracking the COVID-19 data together because next week is our final show in this webinar series. That will mark 11 webinar shows. So let's go ahead and get started and talk about this last week of COVID data. So as always, we have 4 points. Data points that we reviewed together, and the first one are the new cases computed on a 7-day rolling average. And of course, now you all would be able to tell me how that statistic gets computed. So as we were reporting last week, we have seen this very, very steady increase and very sharp increase in early November. We saw this drop, and this drop was attributed to the holiday having a slowdown in not only testing, but also in reporting. And as soon as the holiday was over, we then have seen now a pickup in the new cases that we're seeing per day. And that in fact, today, the new data was released, and there are actually now 320 new cases. We're averaging 320 new cases on a given day. The number of active cases on any given day. Just like with the new cases, we have been seeing this steady increase, and then in early to mid-November, we saw this really sharp increase where we were doubling the number of active cases. Again, went down a little bit while we had the Thanksgiving weekend. We have went up and we've come down just slightly. And as of today, December 7th, we're reporting 3,752 active cases in St. Joseph County. The percent positivity, this represents the total number of people who've taken the test and the percent that are positive as a result. And interestingly, we have a statistic here that is the highest since we've been talking about and tracking this data together. So since early September, we started out with about a 64% positivity rate, again, meaning of all the people who were taking the COVID test, around 6.4% of them were positive. Again, tracking this slow increase, and then early to mid-November, we had a pretty sharp increase. We had a decrease that we attributed to holiday weekend, and now we are seeing again that we are on the uptake. And for today, on December 7th, of all the people who are taking a COVID test, 14.6% of them were testing positive. This is the R0 estimate. This represents community transmission. This chart looks a little bit different than the other 3 data points in that the R0 is a much more difficult statistic to calculate because there are so many factors that go into developing this statistic. But the thing that we can note, similar to what we saw in the other charts, was that there was an increase leading up into Thanksgiving, and then we saw a decrease, and we are now seeing again another increase. So when we have an R0 that is above 1.0, we know that there is active transmission going on in the community. If it falls below that 1.0, we know that transmission is slowing down. So let's talk a minute then about what's happening then outside of that data and translating to what's happening inside of our hospitals. This has been making the headlines as of late. Elkhart, Goshen, and St. Joe County reporting steep increases in hospitalizations. So here you can see the 7-day average of new cases is the orange line, again increasing. Here's this decrease we had for Thanksgiving, and that we're back on the upswing, unfortunately. The blue line represents those individuals who have been hospitalized as a result of COVID. And again, that's following the increase similar to that of the new cases. And so again, going back to the headlines, what the CEOs and medical directors are telling us about COVID and hospitalizations is that they are maxing out their hospital beds. I believe it was Elkhart who reported that they were over 100% capacity last week. The fatality data, this is the deaths that are associated with the long-term care facilities in St. Joseph County. And I've presented this data to you before. This comes from the St. Joe County Health Department. October had marked a very significant month with the greatest fatalities in St. Joe County. 58 of the 73 were attributed to a long-term care facility. In November, we had 80 deaths, so there was an increase in the number of deaths in November. But this time, only 31% were attributed to long-term care, with the majority of them being outside of a long-term care facility. So that now 63% of all the deaths in St. Joseph County are attributed to long-term care facilities. So I've also pulled some headlines from national headlines as well as from our own paper. And in the first headline, Indiana has the second highest COVID hospital rate. This was on December 2nd and was in the South Bend Tribune. And what it's saying is that roughly 50 out of every 100,000 Hoosiers are now hospitalized with COVID. And this is significant because it is a sharp increase from just the week before. And only South Dakota, at 61 per 100,000, is doing worse. And while South Dakota has about 480 hospital beds per 100,000 people, according to the Kaiser Family Foundation, Indiana only has 270 hospital beds per 100,000 people. That's alarming. The other headline, COVID-19 alert, the 10 riskiest states to visit a week after Thanksgiving. This was on December 5th. And as you might guess, Indiana shows up on this list. South Dakota was ranked #1 as the riskiest state to visit. They have no mask mandate. They are averaging 116 new cases per 100,000 people. And of all the people taking the test, 47% of them are testing positive. Indiana is ranked the 8th riskiest state to visit in the United States. We do now have a statewide mask mandate. We are averaging 86.1 new daily cases per 100,000 people. And of all the folks who are taking the test, the COVID test, 13.5% of them are positive. Indiana's percent positivity is at 13.5%, which is nearly 3 times above what the target, the WHO target, and positivity has been rising for the past 2 consecutive weeks. So this is a schematic that I put up each week talking about how public health experts and epidemiologists use this data. And the 4 data points that I have presented each week are around new cases, our active cases, the percent positive, and our community transmission. We take those things all into account. We listen to what our community is telling us, and then we make decisions based on that. And from the data that I presented, in some situations here, for instance, with percent positivity, we are at the highest rate we have been since we started tracking this data together in September. The headlines are telling us that hospitalizations are going up and that we are at risk of running out of bed space at our local hospitals. This means we have to double down on what it is that we're doing to protect ourselves and protect our loved ones. So in listening to our community, we need to continue to do the things that will protect us. And so as I presented week to week as a public health advocate, a public health expert, I'd remiss in not sharing these again week after week, sounding somewhat like a broken record, but knowing that these are the things that will protect us as we move through the holiday season. So host those activities outdoors when possible. Try and limit our guests to just the folks who are here in the local community. Limit the number of people who are coming to your house or to your activity. Encourage guests to wear masks and use hand sanitizer. And oh, by the way, the CDC is also now recommending when you are mixing households that you even wear a mask indoors. And then ask guests to strictly avoid contact with people outside of their households for 14 days before gathering. So in closing, as always, here is our email and our data sources. It has been a real pleasure working on this project, this webinar, and tracking this COVID data with all of you during the last 10 or 11 weeks or so. Again, my pleasure. And if you have any questions or comments, please email me at consider@nd.edu. Thank you.